Well, welcome everybody. Welcome to 2026 at the CoCM SIG meetings. My name is Ben Hilliard, and we're going to quickly introduce everybody else with some really quick, fun stuff so you can get quickly to know us. If you have a phone, um, please do that. But there's also, I'll show you the uh, Mentimeter in a second. But welcome everybody. And Annie, Ashley, you have any starting thoughts for before we get going? Okay, so this was
Ready.
Annie's idea, so I loved it. So real quick, not to spend too much time, but I'm going to share my screen and put this out there. And just checking to see if everybody could see my screen.
Yeah.
Okay, so if you could just quickly take a snapshot of that QR code or go to the website and then enter that code. It's something we've been doing regularly, so hopefully we have, if that's working for everybody. All right. Um, I'm going to start off with you, Annie. If you do you mind reading yours? Okay,
Yeah,
so
that's fine. I can do that. So,
okay.
um, two truths and a lie. Number one is I have an impressive collection of vintage fondue pots and host an annual chocolate and cheese party. Number two, outside of work, I enjoy making hyper-realistic cakes, and I recently created a cake version of a Nike Dunk Low Panda for my sneakerhead nephew. Number three is I am on a competitive synchronized swimming team, and we medaled in 2024 with an Elton John tribute routine. So guess the lie.
Either everybody knows you well or people don't know you at all so far, you know?
Yeah.
I- If the first two are, well, for any of them that are true, I feel like if you're willing to share some pictures, that would be so cool.
Well, I don't have pictures for one of them.
All right, so let us know. What is it?
Wow, that's cool. The lie is the second one, the hyper realistic cakes. Over the winter break, with my kid, we binge watched Is It Cake? So I'm just very, um, yeah, that's on the forefront of my mind. Those, and it's incredible, and I could never do it ever. So that is my lie. But one and three are truth.
And Annie, can you just give us a brief overview? Because now you're the co-chair. Can you give us a little brief overview of
Yes,
what you
I'll
do?
take
And
a
okay.
couple minutes to just, yeah, how I came to collaborative care. Started working in, after grad school, started working in rehabilitation psychology, actually. And so working in settings where people were focusing on a variety of different disabilities. And the office I started at was actually sensory disabilities, but I ended up specializing in working with patients with neurological disorders who wanted to return to work and including patients with mental health conditions, bipolar disorder, depression, schizophrenia, things like that. Um, so I loved working in mental health. Then I transitioned to some shorter period of time in community mental health. And then I transitioned into primary care and just kind of fell into collaborative care. I'd never heard of it before. But Dr. Ratzliff, who is the co-director at the Ames Center, was my psychiatric consultant at the Country Doctor and FQHC in Seattle. Um, so I learned a ton from her, and then over a period of time did some um, just consulting work with the Ames Center and some training, but have only worked with them full time for the last 5 years. But after working at Country Doctor for a while, I ended up moving from Seattle down to Olympia. And then I started working at Providence Medical Group in Southwest Washington. And that's, I actually started with implementing an expert program But I was like, hey, while we're screening patients with these two pre-screens around alcohol use and substance use, we could also tack on a PHQ-2 or PHQ-4 and simultaneously align kind of population health programs to serve multiple purposes. So we started then implementing collaborative care, then moved into kind of a director of behavioral health integration for Southwest Washington for that healthcare center and implemented collaborative care across 11 primary care sites. Two of those were rural, and then transitioned to the AIM Center. And yeah, I think once I moved into even though I had no idea what collaborative care was or what really I would be doing once I moved into the primary care setting, I instantly was hooked because I loved the environment of the multidisciplinary environment and that team-based care. And I didn't love working under the same roof of where everyone did the same thing and where we were
Mhm.
all therapists and kind of in the same boat. I really loved collaborating with at Country Doctor. I was next door to like the HIV clinic and the diabetes educator on either side of my door, and and then working with the PCPs as well. So I think that's what instantly hooked me, and yeah, that was like I don't know, 15 plus years ago, more than that.
Excellent.
Yeah,
Well, welcome to as the new co-chair. Excited to
thank
have
you.
you.
I'm excited. Thank you.
Ashley, you up? Ready?
Can you hear me?
Yep.
Thank goodness. I got a new laptop and it's an adjustment disorder in itself. Okay. So hi everyone. Okay, so two truths and a lie for me. Here are your options. One, I adopted a Belgian draft horse named Belle. Two, I stepped on a sea urchin in Australia. Three, I read 24 books in 2025. What am I lying about?
Uh-oh.
This is fascinating.
First two are catching up.
I tried to be very specific for each of them in hopes to throw everybody off.
All right. So give us the what's
Okay,
the lie?
so I lied about reading 24 books. I definitely, I'm sure, read, 23 or, 24 plus research articles for the work that we do. Did not read full books. And I did. I adopted a Belgian draft horse. She's a rescue this last year, so April will be a year that I've had her. And yes, I stepped on a sea urchin on Australia, and I actually went to a kiosk to get a needle sewing kit and got it out. This was a long time ago, but happy to share some interesting facts about myself as you get to know me.
Can
I
can you
can go,
introduce yourself as the
yeah,
secretary?
yeah. So for those of you who don't know me, so I'm a clinical program manager over at Hartford Healthcare, which is in Connecticut. I oversee both our PCBH and our CoCM programs here. I have BHCs who cover 40 of our now 78 primary care offices, and I have 3.5 care managers that cover 12 of our 78 primary care offices. And we just got approved for expansion. So it's very exciting times here in Connecticut for us. So after grad school, I actually primarily worked as a child trauma therapist at a local LMHA, and really, got burned out a little bit early on in my career. I'm sure that resonates with some other folks on this call, and actually went to work for a Visiting Nurse Association. I was their MSW for the Visiting Nurse Association of Cape Cod, and I remember thinking to myself, is anyone out there in primary care or somewhere in the specialty space reading these notes that I'm writing about these patients? It was super helpful, of course, for my eyes and ears, what I was picking up on to share with my colleagues, right? OT, PT, speech and language, and the nurses. But I remember thinking, wow, it'd be really nice if we had regular meetings. And I found the medical field super interesting. My father had passed away from pancreatic cancer, and I really didn't have an understanding of anything medical or physical health related diagnoses. So just really jumped in head on, learned a lot. Actually went to work for Boston Medical Center. I worked in their CCUs for a while. And we all know, typically in the hospitals, acute settings, it's more reactive care, especially in the units. And I just felt like I don't know where these patients are going afterwards. And I don't even know really who their primary care providers are. And then I heard of the fact that there were behavioral health providers in primary care. And I actually started as a BHC in 2019 here at Hartford Healthcare. And then I learned from Monica Harrison, who helped launch CoCM here at Hartford Healthcare, that, there's a program that's evidence-based and integrated that involves a psychiatrist, more team members, great. And so I helped launch CoCM in a couple of practices. And then this position as the program manager seemed like a natural progression since I had worked in both programs, done the work, and had a variety of experiences in other medical settings and certainly, outpatient behavioral health settings. And I love it. I'm a huge fan of behavioral health education and feel grateful every day that my team gets to provide that for not only our patients, but our providers, support staff, in the larger communities that we serve. So I'm super happy to be here, as the secretary of the SIG. It has taught me a lot. CFHA in general has taught me a lot and been such a godsend as I've entered the integrated care world. And honestly, I can't see myself doing anything else. I've stayed here 6 years and just want to keep expanding my programs here and learning more from all of you. I think that's what's most important. So thanks for the
All right.
space.
So now my turn. Real quick, want to try to find the lie. I've kayaked most of the Class 5 rivers from Maine to West Virginia. I hiked most of the 4,000-foot mountains in New Hampshire, and I drove a motorcycle solo across the country from California to New Hampshire. And after this, we'll get into the real meat. Wow, dead even. So not to delay any longer, the lie is actually I have not hiked any of the 4,000 footers in New Hampshire. So, but the other two I've done. So I'm a little of a risk taker. So quickly, my background as a mental health provider. For 30 years, worked mostly with kids. Did a 2.5-year pilot in pediatrics with CoCM, and then was fortunate enough, I was using a company measurement-based care platform called Mira and joined them after selling my intellectual property to them and then helping them develop a registry. Didn't want to sell software, so I moved on from Mira. I'm still a advisor to the CEO at Mira, and now I'm the vice president of, hey, no fair jumping in at another time to add your vote later on. So now I'm the vice president of clinical success at Janus, and we are in 3 states doing collaborative care. Okay, so now to the meat. So one of the things that we wanted to say and really present really upfront is that we don't want, as Ashley and Amy and I, we don't want to lead this SIG without information from you and what you would want to gain out of it. We have certainly valued our time in here. I think I've been coming for 3 or 4 years now, and thank you for Laura and Monica for their leadership last year. But we want your ideas. So, Annie, Ashley, if you want to add anything else to that before we go into those 3 questions.
No, I think you've prepped us well. Yeah, we are, here to facilitate and the collaboration across this vast sea of knowledge that you guys bring to the table. So I'm excited.
So if you could, just add some short answers to this, that would be great. Ashley, did you want to add anything? I didn't even let you.
You're good. And I want to hear from everybody, so I'll be quiet. Are we putting it in the chat or talking out loud?
It should be a open response in the Mentimeter.
Oh, in the Mentimeter. Okay.
Oh,
I didn't scan the original Mentimeter because
Oh.
I knew the lies.
I'm fired.
But
I didn't
that's
even
a
know.
very good point, though. We could talk about it as people are entering. So anybody,
Yeah. Yeah, I think if anyone's comfortable just unmuting yourself or putting thoughts in the chat that we could talk about as a group, that'd be good.
and we have a guest sitting on Laura's lap. Clinic-wide understanding, constant battle. Oh, excellent. Getting PCPs more engaged. Mm.
A good point about the Medicaid.
Payer and compliance misunderstanding of billing codes.
Thank you for saying compliance too. That was what I was going to say. Oh, welcome to CFHA.
So we have 3, it looks like, on engagement of PCPs and MDs. Okay. All right. Does anybody want to jump in and comment on their maybe particularly some of the folks about the getting PCPs engaged? Anybody want to jump out and talk about that? One of the things that I found in my implementations is that oftentimes, just to put my comments in, oftentimes you get either assigned or some primary care doc is very interested in this process, and say you have a clinic that has 5, 6 different doctors, and it's really hard to get that training from the training for the champion to trickle down into the other providers. So Laura and I had talked about before is that I often see a successful or mature, CoCM practice when you have a good percentage of the primary care docs engaged. Wonder if anybody else had that experience or that observation.
Speaking from the medical director side, talking with providers and docs across the country, there's still a lot of feeling like integrated care is more work. And I think the messaging can't be, oh, it's going to actually be less work. It's really looking at it working smarter, not harder. But to do that, there is a learning curve. And I think we're still navigating a lot of misunderstanding about basic definitions, even like the word collaborative care. For instance, collaboration is not the same as collaborative care model. And really platforming voices of PCPs, helping them to see how to improve efficiency, and then having systems built and organizational support for them to be more efficient and not just simply kind of taking on this piece of championship. I think there's still a hurdle to get over related to the importance of championship and how that's different from another add-on to already burned out and busy clinicians.
Excellent. Thank you. Um, Next question, what do you see as the main work ahead for research, clinical practice policy, workforce development, and implementation in your interest area? Any short answer or verbal answers or any additions to Mentimeter, that'd be great. Everybody's busy typing. Hmm. Alrighty. Continue with cost saving outcomes too. Getting support and payment from all payers, which I think is an interesting one because I think Verna had put out through the Bauman Foundation an article that said that if you have all payers paying, that relieves a burden of the primary care doc to have to kind of triage referrals into CoCM, which I thought was a super interesting dynamic. More penetration into medical subspecialties. Interesting. Okay. Any verbal comments until move on and we get into some more discussion? Ashley, I don't know if you want to jump in at all.
There was some stuff in the chats about just increasing exposure to collaborative care for training clinicians, buy-in, addressing barriers of copay, more evidence for CoCM in pediatrics is needed, and PCP referrals can drop over time. And it seems like publishing referral numbers by provider and the clinic outcomes supports a resurgence of referrals, but it's an ongoing task.
Yeah, and I would say to Eric, thanks for putting that in the chat. We're actually talking here about like adding integrated care referrals like as a scorecard metric. I feel like there's a lot of different ways you can go about that.
There is. We would in new practices kind of publish it with the provider de-identified, provider 1, 2, 3, 4, and let them know that next quarter it'll be identified.
Yep.
We would tell them who they are. You're number one. But then eventually, we want to uncover that, and it also becomes part of their whole team's approach, right? Because it starts out with sort of the nurses and doing more screenings and saying I think is a good candidate, depending on how much they're involved. But it did create, I don't want to say competition, but just awareness that everyone needs to kind of do it, be involved, or for it to be successful. I think sometimes there's a perception that the other provider must be doing it and everything's fine. We got this off the ground, and it really needs to kind of stay within your awareness.
A little gamified there, huh, Eric?
Well said.
Okay. Last one.
Oh yeah, and Verna added access, not allowing organizations to participate that are direct fee-for-service billing. And that she has a new pro forma that she can share with folks who are interested.
Please share. Verna, you're famous for sharing, so keep continuing
Thanks,
to do
Verna.
that. Any thoughts on this last one? Okay. All right, so let's open it up to conversation. The goal is to get your feedback and then push that into making this hour once a month very profitable and worth your time. So your your comments and interests are super important, and then we'll do the work on the back end to try to meet those goals. Eric, would you mind giving us a little overview of the Health Policy Summit for those who weren't there? Sorry to put you on the spot.
Yeah, I was just thinking, oh, maybe I could dig up the summary, but I'm thinking I'm locked out of my VPN right now, unfortunately. But we did have some takeaways. Actually, it's posted on the webpage. I could pull that up, unless you're quicker at it, Ben, because I know you've got your screen showing. But the summary document that Concert helped us to put together has a nice overview of the outcomes of the summit based on the participation of the 70 plus attendees. If my hands don't work when I'm talking sometimes, sorry. Um,
Well, while you're looking for that, Eric, one of the things that we were thinking about is really helping to, as a SIG, to promote and keep that agenda on the, top of everybody's mind throughout the year, not to sort of focus on it fully, but, all that hard work that you did and some of the work that Verna and Claire McNutt from, are doing right now for next year's conference. We wanted to help support that and, have occasional meetings based on that. Um, so that's one of the reasons why I brought it up. But Eric, you did a great job. It was fun policy meeting, which as I said earlier, was great to do and great to see everybody there. But we want to keep that going. Um, Verna, are you still there? Verna's at two different meetings, but do you want to jump in there? Ashley, do you mind messaging her? I think she asked us to message her if she wants.
Yep.
Any things that you guys would want us to do? Last year we did a lot of presentations and some meetings just for us, but what kind of presentations, what kind of speakers would you want? What kind of things would make this time profitable for folks?
Ben, this is Gian Joyner. I can give some updates on the CoCM Policy Summit
Great.
planning, if that's helpful.
Yeah, that'd be great.
Sure. So it looks like Concert and Meadows are providing financial support, including a sit-down dinner, which is similar to last year. AIM Center will also be supporting the summit. We've secured a speaker from both a practice and payer involved in a shared savings agreement for collaborative care, and this will be presented as a model for replication. We also have individuals from our various collaborative care work groups, including early childhood, pediatrics, women's health, geriatrics, and substance use disorder, who will present their work and pathways, also including our national collaborative care research work group, who will present outcomes from data collected over 1 million patients. It looks like a presentation as well from Mercy Health. And they are an organization serving tens of thousands of collaborative care patients. We have secured a panelist from Montana and are working on additional panel members, continuing to consider more representatives, including from residency programs and larger collaborative care initiatives. Similar to the last summit, Concert will handle project management and take on the white paper. In terms of engagement from legislatures, we're also considering involving state legislatures who have supported collaborative care for recognition and are looking for more payer engagement and federal officials to participate in the panel. Definitely open if we want to speak now or people want to reach out to suggestions for these additional panelists, attendees, and potential planning committee.
Thank you. And we just had a request from Liz about the date and location summit to be determined, I believe. But it's last year it was prior to the national conference, so likely it's going to be similar to that, but to be determined, I believe, unless there's any other information that folks know. Okay. Ashley, Annie, we were talking about some initiatives. We were thinking about potentially developing some videos, things of that nature. I don't know if we want to talk about that. The idea was getting this group of well-known and folks who really know COCM well together is to help develop some scripts and some general idea of what COCM is and was, so that we could have sort of uh, a resource that we could all use in helping to educate COCM, much like with those primary care docs, to have short videos, things of that nature that were sort of open source. It was just an idea generated, and those are the types of things that we're really interested in doing, plus the speakers and developing resources for everybody. So if there are things like that that people are interested in and have thought about, let us know. We want to be here for you and obviously make this, as I said before, a very valuable time.
Yeah, and just to piggyback off of that, when we first started talking about the idea of like universal um, little COCM tutorial videos to be used widely, it made me think back of like the PCBH corner videos that I would share with like new BHCs as a way to, help them feel more confident in the role and have a greater understanding of it. Even doing one for like a BHCM, right, I think could be helpful because I see all the PCBH videos circulating around, and I think there is an opportunity. We were even talking about it here in my organization, like testimonials from like nurses, the front desk, et cetera, to utilize when teaching other offices on a smaller scale about when COCM comes their way. Is anyone already doing that, utilizing that kind of media, or have go-tos for whether it's scripting, et cetera? I'm sure we each have our own varying degrees of standard work. Oh, thanks, Kim. I love dreaming of a podcast.
Yeah, and often, like I mentioned before, those, getting that and buy-in and understanding videos could be things about billing, or it could be about, outcomes, benefits to COCM, quick little hits that, things that could help us all as sort of a collective collection of all of our knowledge that we could all use. So that's one idea. We are thinking about speakers as well. So speakers on some of the topics that we talked about, we will look into and get back to you. May reach out to you as well. One of the other things that we talked about is developing, I don't know what we call it, Ashley, or anything. We call it like not a registry, but a
Oh,
connection
directory.
directory, yeah, of contact information. So, if I had a question about something in Washington, I could give Christina a call, things of that nature. And we do have, various different ways to communicate, but ways, to share our information and share our knowledge and be open. And so that was another idea, and wondering if that's something that would be interesting to you guys. I don't know if Annie and Ashley, you want to add to that.
Well, I know, certainly we can all, email Basecamp and send it out into the universe and see what comes back. I do think it would be helpful to have a live directory that could be, edited, if folks leave varying positions of, who to contact in what state
And we could,
when folks are running into barriers, et cetera. Sorry, Christina, go ahead.
oh no, I was just going to add in, and maybe that could include, like, yes, what state we're in, but also, what might be some areas that we've done a lot of, I don't know, work on or struggled through or lessons learned or something like that. So like if somebody wants to talk to, if I wanted to talk to somebody about, okay, how can I understand more about, assuring Medicaid coverage, et cetera, it'll be checked up off under some people's names or something like that.
Like specialties almost.
Yeah.
That's a great idea.
Fantastic. Yeah, we didn't even think of that, but that specialty area gives us more dynamic opportunities. Excellent. Any other suggestions on speakers or things if folks would want that we can do some work on?
Well, I know one thing I shared with you both, and I'll share it with everyone else, is really how to reassure our care managers around navigating like moderate to severe referrals, being less anxious about it, like let's try it. I think would be a helpful discussion at some point. I was letting Ben and Andy know one of my care managers attended Daniela's skill set webinar recently. I think it's December 10th, and came back and said, guess what? Across the nation, they're seeing moderate to severe too. What do we do about this? I'm like, well, we see that. So maybe having a community conversation around it, how folks are navigating, those supervisory conversations would be helpful. Certainly would be helpful for me.
Laura, I don't know if I could pull you out on call you up, but you put in something you'd be willing to jump in and talk a little bit more about it, the case-based learning sessions. Oh, she's doing double duty.
Oh yeah.
Yeah, I got a kiddo home with some GI bugs, so doing double duty. I think always case-based learning is really great, and taking like a sample vignette and just seeing how different people are doing various parts of the CoCM process is a great way to learn kind of like from more of a real life clinical example. And I think we could do that from multiple lenses, from the clinical approach, operational approach, financing approach,
Mm,
and keeping the vignette pretty simple, but having it kind of highlight some of these different areas would be a cool experience process as well as outcome wise as a group.
I love that idea.
yeah, that's great. Um, One of the things from the Mentimeter was doctor engagement, and understanding, and we also mentioned about compliance, implementing. You can get those folks that are the primary care docs, the champions, and things like that, but then you get through this whole process, and then the compliance folks, put the kibosh on it. There's always a sort of the mental health, folks with a more mental health background tend to put their policies on it, and then you have to explain it over and over again. It's a conversation I've had many, many times. I'm going to have it on Friday as well. So I wondered if that's a topic that people would be interested in. Is really engaging those folks that are sort of secondary to the sort of the implementation process that come in. Patricia, I see you nodding your head. So
Yeah. And I know when I've brought that up to various folks, they've suggested we'll have compliance join like the office hours with the AIM Center, right? And then they don't. So I think it would be helpful for all of us to have, kind of fallback scripting or varying points to navigate those conversations with compliance.
Okay. Nicole, would you have the ability to talk a little bit more about that in the chat? Asynchronous training for revenue and billing staff?
Sure. We made mention of this a little bit at the conference, but there are some online trainings that we're working on. And the date, unfortunately, right now is to be determined. We're working to get them released as soon as possible, but they will have some of the components that the team has been talking about today that could be helpful. For example, some recordings of individuals that are in these roles and their individual experience. And we tried to access some professionals across different states and organizations to talk a little bit about what they're doing in the model from their different roles and perspectives, and then also We also use some cases that we built to kind of help walk folks through an example of what collaborative care could look like in action from some of these different perspectives as well. So as soon as we have a release date, we'll let the team know. We're really excited about it, and hopefully they'll be a helpful resource for, different folks in different collaborative care related roles.
Excellent.
And we'll make sure to blast that out on CFHA as soon as it's available.
Excellent. Fantastic.
Nicole, is there pediatric focused stuff in that, or is it mostly adult?
Yes, there are pediatric components. We try to speak to some of the different populations that can be served in collaborative care. And then, but it's not per se like a pediatric training in and of itself. It's
Mm.
talking about collaborative care, and we talk about pediatrics within that.
Okay. Great, thank you.
And Katie Steele, please let me know if I'm misspeaking on any of this. She is the wizard that pulls
Hi, Katie,
policies.
right?
Oh, that's right, Nicole. I was just going to add, Kate, that we have the subject matter experts that we've included in these videos come. We have folks that are working in pediatrics, folks that are working with aging population. So that's really where I think that specialty lens comes in. But we're working through the accreditation now. So as Nicole said, like we'll share those ASAP when we can.
We're just starting to think about figuring out how we can get some practices to dip a toe. And so anything where you all are already developing materials, like if you put stuff that doesn't have anything with kids in it in front of a bunch of pediatricians, they're like, this is not about us. So, but I would love to be able to share the good work that you all have done. So that was why I asked, not because I need something entirely pediatric focused, but if they at least can see themselves, which I think is the whole reason for doing these videos, right? Is so that different roles can see themselves and understand. So I appreciate that. Thank you.
Excellent. Kate, I'd love to talk to you about that. I did a pediatric practice and pilot, and then also about to launch in 8 practices, pediatric practices. So we're way deep into that process.
Great. Happy to take that conversation offline, Ben.
Yeah. All right. Any other? Yeah, actually, Annie, I was just thinking that to save folks a little bit more time off their week, and end it early, unless there's other comments, I'd love to give you guys some time back.
Yeah, no, that sounds good. I just also want to just ask if anyone else has any resources to share, because I appreciate what's been dropped in the chat and hearing about the upcoming resources available from Meadows. So if anyone else has any things, resources to share, I can let you know that there's an upcoming AIMS quarterly webinar that Monica will be facilitating on PCP engagement. So that came up a bit today. So folks might want to tune in for that. And if you're not available, you can still register, and then they'll send you a recording. So I'll drop a link for that. But any other resources, trainings?
I also appreciate how much this group shares with each other. It makes a really big difference for all of us. I know that is for sure.
Annie, you want to give you a minute to put that link in there, or have you already?
It's
There we go.
in.
There it is.
Excellent. All right. Thank you guys for coming. And thank you for your feedback. And we'll take all the information, send it back out to folks, and then give you a heads up of what the next meeting is about. As always, feel free to reach out to me and to Annie and to Ashley.
Oh, one other thing,
yeah.
just to mention, next time we'll probably spend some time talking a bit about proposals for next year's CFHA or this year's CFHA conference. So just wanting to put that bug in your ear to start thinking about it. You don't have to have anything like well developed, or an actual proposal, but if you even have ideas, and there might be other people in this community that have similar interests or information to share. So it would be great to pair up some folks if people are interested in presenting. So bringing kind of what you're thinking as far as topics or interests for possible topics, because I think next time we'd have to cover that next time because they're due the end of March. What?
March.
Oh, yeah, I don't remember.
It
They're
might
due
be
in
March 15th.
Okay.
Yep, March 15th.
Yeah. So just to put that on your radar to start thinking about topics. That's all.
Thanks, everyone.
Thank you. Have a great day.
Happy New Year.
Bye.
See you.